Hello, this is Dr. Victor Liu. I'm a plastic surgeon in Burlingame, which is near the San Francisco airport. I'll be talking on facial rejuvenation tonight, and I'll cover different aspects of facial rejuvenation. Some of it may apply to you and some may not be, but what I want you to do is ask yourself as you're watching me give you a talk, as to what is best for yourself, and we'll try to answer that question later. Now, what I would do is first of all talk about what are the changes in the face when you get older. It shows a lot of different changes as one age. You can see that there are changes in the skin, there are lots of wrinkles there, and there are loss of fat underneath the skin. There is a change in the so-called muscle of expression in the older person. You have a look of an older person when the corner of the mouth is droopy and so on and so forth. And then of course the bony structures and the looseness of the skin and different how the skin is like and so on and so forth. Now, with a patient like this, how do you change it to this? Now, this patient has a different treatment done. First of all, the skin. We did a facial peel to get rid of the wrinkles. We put some fat underneath the skin, and then the skin has been tightened. The eye, as you can see, is toric, means it's droopy, and it's different on two sides. So what I did was to even out the eyelids. So what this patient had was a chemical peel, fat injection with stem cells, tightening of the skin, eyelid surgeries, and so on. And of course, another factor is the skin care. After the patient had surgery, we put them on skin care program and of course appropriate makeup. So now again, in summary, on the left is before surgery and on the right side is after surgery. And as you can see, there's quite a bit of difference. Now, this patient really had the full treatment. In the next patient, this patient is less, but you can see the big amount of difference. What she had was tightening of the skin in the neck, as well as remove some of the fat there, and some fat was put on the face itself, and then the skin was tightened as well. Now we try to show you different types of patients, both men and women, and the different skin types, like could be Caucasian, could be black, could be Asians, and so on and so forth, and to show you that we can do treatment on all these people. Now, this man had fat in the neck, and the chin is a little bit recessed, and of course the skin in the face is a little bit loose. So what he had was removal of fat in the neck, tightening of the skin, and in his case we just put some fat in the chin with no implant. I usually prefer a chin implant, but in this case he did not want to have that, and he just wanted to have injections with fat. Now this patient is black, and we not that much was done. We tightened the skin a bit, and she looked very much better with that. The reason I show this patient is the fact that a lot of people feels that you should not do facelift on black people because of the scarring involved. But as you see this patient in front of the ears, there's no there's no scarring. Well, there is, but it's not perceptible. And you can see it's right in front of the ear. is where the incision is. If you look at this picture, this next patient, again, mainly in the neck, and the chin is small, and she wanted to have the skin in the neck taken out and the fat removed, and some fat is injected into the chin to make it more prominent, and of course the skin of the face is tightened as well. Just to show an Asian patient with a similar type of procedure. And the next patient, now it's not too obvious to most of you, I would think, what was done. Now this patient has very bad skin and he has lost a lot of fat. Now most people would think that he would benefit from a facelift, but this wasn't done on him. What was done on him was fat with stem cell injection into his face to plump up the skin a little bit, and the stem cell is used to rejuvenate the skin. The stem cell has the ability to replenish what is lost. For instance, as one age, the collagen is gone, and then elastic tissue is gone, and the stem cell can replenish that. And of course, he also had a chemical peel of the face, and he looks very much better. As you can see in his neck, before the surgery, he has some excess of skin, and after the surgery, he had the same. So he really did not have a facelift. If he did have a facelift, that would have been tightened. This is just the side view of the same person. Before the surgery, the skin in the neck is loose, and after surgery it's slightly tightened, but still loose. And no facelift was done, no incision was made. All he had was fat injections and chemical peel. This patient, again, has loss of fat and wrinkles in the skin. And all she had done, again, was the stem cell and fat injection in the face and the chemical peel. This patient looks so different before and after that the only way you can recognize her is the color of her eyes and actually the nose itself. So now she again had no facelift. She had a so-called stem cell facelift. Now, it's another patient. Actually, this is a nurse of mine, and she had very minor things done, and she had a chemical peel and some fat injections. Well, this patient had a chemical peel, fat injection. Take a look at her eyelids. I didn't do anything to her eye in terms of surgery. All she had was a chemical peel and fat injection. And you can see there's a huge difference, although no actual surgery was done. This patient is similar, had a chemical peel, and as you can see, a lot of pigmentation before the surgery, and afterwards the pigmentation is gone and the wrinkles are gone as well. Now this is a younger patient with acne scarring, and acne scarring, the chemical peel can get rid of the acne scarring. Well, again, younger patient with chemical peel and stem cell injections. Not every patient needs surgery, and in this particular patient, she has some excess of skin in the neck and some fat there. She does not want surgery. She just wants something done. Now, we do a procedure called thermi-tight. What it is radio frequency with a difference. Usually, when radio frequency is done, we put it on the skin to project the radio frequency into the skin to tighten the skin. But in this case, we use a thermi-tight, which is a needle. We put a needle underneath the skin to send out the radio frequency, and that tightens the skin. This does a much better job because the skin can be tightened more without hurting the skin surface itself. Another advantage of this is that the needle can be put into where the fat is, and the fat can be dissolved or obliterated by the heat and then absorbed by the body. Now this is another patient, similar kind of treatment, thermi-tight. This is again a non-surgical procedure. Again, the same thing with some removal of fat and tightening of the skin. Now, another non-surgical procedure is a thread lift. This is a so-called instant lift. What it is we put a special type of a suture underneath the skin without surgery. Just use a needle, and this tightens the skin. Same thing here. The patient does not want to have surgery, and she does not want to have downtime. So this procedure use just needles, and you can tighten the skin that way, and the patient can practically go back to work the next day or the day after. Now this is another type of treatment. It's called a thermi-smooth, and all this is radio frequency without the needle. We put it on the skin itself after we apply medication. The nice thing about this is that the radio frequency will drive the medication deep into the skin to do its job. And the results are not that dramatic, but there's absolutely no downtime, and there's not even a needle involved, and there's no numbing required. Now, now to answer the question as to what is the best treatment for you, you probably have an idea at this time. And what the best treatment is the right treatment. In other words, what I do is when the patient comes in, I'll ask the patient what they expect. What kind of results do they expect? Now, you'll be surprised the different expectations from different people. Some people say, oh, I just want a little change and want a little bit better, look a bit more refreshed looking. And some people will say, oh, I want a total treatment, I want to look as young as I could, and so on and so forth. And then, of course, this has to be balanced with the downtime involved. Now, some of the procedures have absolutely no downtime. You can go back to work the next day, and some procedure, like if you do a full facelift, will take at least 2 or 3 weeks to recover. So the right treatment for you is the treatment that matches your expectation. And what you expect is important in terms of results and downtime. So we will be giving this kind of lectures in my office actually once a month. And for those of you who are interested, you can call my office and we'll give you a list of all the different seminars, the different topics and the timing, and you're all welcome to come. So thanks very much for listening. I'll see you next time.